What is a psychological disorder? According to the DSM-5, these are the 5 factors that need to be considered when trying to define a psychological disorder. 1. A behavioral or psychological syndrome or pattern that occurs in an individual. 2. Reflects an underlying psychobiological dysfunction. 3. The consequences of which are clinically significant distress or disability. 4. Must not be merely an expected response to common stressors and losses, or a culturally sanctioned response to a particular event. 5. Primarily a result of social deviance or conflicts with society. Culture-bound syndromes. According to the book, culture-bound syndromes are those that appear to be greatly influenced by cultural factors and hence occur far less frequently or are manifested in highly divergent ways in other cultures. Amok. Amok is a syndrome that is prevalent in Southeast Asian cultures. It is characterized by an outburst of violence and homicidal attacks that usually end in brooding, exhaustion, and amnesia. They predominantly occur in males. It is thought to be caused by stress, lack of sleep, and alcohol consumption.
Hysteria. Hysteria was common in Europe in the mid-19th century and was only diagnosed in women. It was characterized by symptoms such as fainting, insomnia, sudden paralysis, temporary blindness, and generally causing trouble. Diagnosis decreased after classifications of disorders became more sophisticated, as hysteria was used as a sort of coverall diagnosis for any out-of-the-ordinary symptoms that women would exhibit. Other culture-bound syndromes. Some other culture-bound syndromes include phrygophobia and voodoo death. Phrygophobia is common in China and is the fear of getting a cold that causes people to dress in winter clothes, even in summer. Voodoo death is common in Africa and is the fear that a curse has been or will be put on them that can sometimes become so great that it leads to suicide. Universal syndromes. Universal syndromes are syndromes that generally are not culture-specific and are found in multiple cultures and are very common in multiple cultures. The first universal syndrome is depression. Depression is something that almost everyone experiences at some point or another in their lives and is not culture-specific. It is considered to be one of the most common psychological disorders, and there are 9 symptoms of major depressive disorder. They are depressed mood, inability to feel pleasure, change in weight or appetite, sleep problems, psychomotor change, fatigue or lack of energy, feelings of worthlessness or guilt, poor concentration, and suicidality. At least 5 of these symptoms need to be present for diagnosis. The second universal syndrome is social anxiety disorder. It is another very common psychological disorder, much like depression, and is more common in cultures that emphasize fitting in. It is the fear that you will act in an unacceptable manner that will result in social consequences, and it can lead to people avoiding social situations entirely.